I want to welcome everybody to our webinar. This is a follow-up webinar to the webinar that we had last week at this time. The topic today is closing the loop with TouchCare. I'd like to introduce Rob Lehane, who's the CEO of TouchCare, joining us today. Myself, I'm Rich Wicklund, CEO of BenefitsApp, and we have Jonathan Anders, who is our benefits industry expert, who will finish up the presentation today with comments based on his 25 plus years in the industry. A little housekeeping, we will be recording today's webinar. I will follow up by sending a copy of that recording to everyone that has attended today. I want to thank everyone who's joining us, rejoining us from last week. Thanks for your continued interest. If you have any questions, please submit them by way of chat, and we will respond to them if we have time at the very end. This is a real-time effort. We are in the process of launching our COVID-19 health survey, and I will show you a quick demo of that and where we are. The product is launching on Monday with several of our clients, and we're very excited about this. So we'll show you where that is during this presentation, and we'll get started. So welcome again, everybody. BenefitsApp is benefits made mobile or benefits made easy. We bridge the communication gap between open enrollment and when employees need to know their benefits throughout the year. We've recently launched, or are launching on Monday, our COVID-19 health screening tool. There's a lot of screening tools out there today. This one gives you a lot of control, connects your employees to your human resource department, and gives access to understanding both at the employee level and the employer level whether people should return to work safely, monitor their symptoms, or potentially seek help. Today, we're going to we'll show where we are on that development, but also discuss the follow-on to if someone needs to monitor their symptoms or seek additional help. And that's why we've asked Rob to join us today to discuss that through our integration with TouchCare. He will introduce himself and TouchCare a little later on in the presentation. So last week we covered that employees need a convenient tool to monitor their health status. It needs to be sustainable, repeatable. Employees need guidelines. So they need to know based on your company priorities whether they should be coming to work or not. Guidelines should be set based on CDC but tuned to your particular needs. Must be HIPAA compliant. This is important personal health information. And so the system is HIPAA compliant. As Rob gets into his part of the presentation, that follow-up, that personal follow-up, I believe needs to be HIPAA compliant too, as you're discussing PHI with your employees. Should be visual and clear with clear direction. Should provide a dashboard view of employee data, which we're very excited about. Have the opportunity for employee follow-up, be supported and highly available and secure. So these are the topics that we discussed last week with Jeanette Partlow of Maryland Chemical. The user experience, once again, is you have secure access. For those who didn't join last week, secure access through BenefitsApp. You download the app from the app stores. You have secure access that is based on your company and your employee ID. You can have access to your information, click access to your profile, benefits information, ID cards, human resource calendars, features like click to call, click to email, contact forms that are HIPAA compatible, compliant, as well as access to other data and apps. We typically carry full benefit guides within it as a convenient resource. Again, from last week, we had prospects and clients say, do we have to have the benefit information right now, or can we add that later at open enrollment? And of course, we can start with the COVID-19 screening and then add that content later in the year when it's appropriate. And then you also have access to profile information. There's a recording of last week's webinar for those that are new that can see that in more detail. Within the Benefits app, we have the ability to do highly segmented push notifications. So we can push notifications to people who have downloaded the app within your company to everybody. We can also push it to just say people that have taken the survey and have a yellow score or a red score. So we can segment push notifications to employees that have the app. Push notifications go out to anyone that has installed BenefitsApp on their phone, and have agreed to receive push notifications. We also offer in-app notifications as well. When they get a notification in the morning and say, click access to your COVID survey, when they do that, it launches the Benefits app. You have access to both the survey instructions as well as information about how the survey works. Once you take the survey, you answer 6 or 7 questions that are recommended by the CDC. Those questions are changing fairly often. We've focused in on the questions that were provided that give us good information about a week ago. Once you take the survey, you're either good for work, monitor symptoms, or stay at home for a period of time. And that period could either be a 3-day stay at home or a 14-day stay at home. And again, these things can be modified based on your corporate needs if you have essential workers or in your industry. So it's a very flexible platform. What I'd like to do is take a quick second to show you where the product is. So you should see my phone right now. Again, we're in a sandbox environment. This will be released to production this week and then released to clients on Monday. When you log in, you may have noticed that we have single sign-on through face recognition. When you have access to your benefits, other information, related eligible members within your eligibility file for your benefits. If you click on the COVID-19 survey, you can go into the survey. So those that receive a push notification in the morning will click through right to this page. It will launch the app, take them right to this page where they can answer these questions. When they answer the questions, they will then be taken to a survey results page. That results page looks like this, survey results. So you will see a list of all the surveys you have taken, and you will also see you're either a level 1, green, good to go, level 2, yellow, monitor symptoms, level 3 and 4 represent either a 3-day stay at home or a 14-day stay at home. You could see your last survey date, and then you can actually look at your survey results. So people will be able to see this interactively on their app. We will also, at the top level, you notice now that there is that similar L1, 2, 3, or 4 next to the employee's name. So they'll have a quick reference that they can click on to get right to their survey. So if someone is green, good to go, based on your company policy, you may want them to fill it out every day or for every shift. You may want them to fill it out once a week. So based on your criteria, you would see your L4, and then we would trigger a reminder the next time they need to submit their survey. If someone is an L4, they need to shelter for 14 days, self-isolate or quarantine for 14 days. We're not going to ask them to fill out a survey every day. We will remind them on the 15th day that it's time to do that. As they do that, in the back end, there's a HIPAA compatible portal for your human resource officer where they can see a dashboard and reports of all the surveys that have been taken. They can click through to the contacts where they have easy access, phone numbers, email addresses, and then other information about the employee. So that is all going to be rolling out on Monday, which is very exciting for us and the clients that have chosen to move forward with us. This information will also be, I know there's some folks on the webinar today that have asked about a demo. You can download the Benefits app and log into a demo account. We will have access to this in our demo account as of Monday as well. So that begs a question as an employer myself. If my employees are filling out my survey every morning and I go to my dashboard and I'm assuming I have mostly green people. Everyone seems to be healthy. They've all been following the rules. But if I have a yellow or I have a red, that causes me concern. And so the question is, what do I do with those employees? As a business owner, and we all know as employers, we all want our employees to be healthy. And it's not just our employees, it's our employees' families, significant others, people that they are in touch with. And so the question is, how do I interact with those folks? How do I take a deeper dive into their potential health issue in a world that's HIPAA compliant as well as dealing with PHI? Do I want my managers asking if someone has a health issue. And do I want my managers to query, do they have extenuating circumstances? Maybe they're diabetic or pre-diabetic, or they have other issues. And so the question is, how do you handle that in this day and age? And are employees comfortable sharing that information with their employer? And how do you deal with that? So Rob, I'd like to introduce Rob Lahaney from TouchCare. He's the CEO of TouchCare. TouchCare is a health concierge organization based out of New York that we're partnered with and we've integrated our app with. And Rob, I'd just like to have you talk to us about how TouchCare works with clients, how you deal with employees, how you get deeper into the discussion so that they can be healthier and we can make certain that they return to work healthy and ready to go.
Yeah.
So Rob?
Sure. Yeah, thanks, Rich. Excited to be partnering with you and the BenefitsApp team as, we sort of think about how we can improve the overall member experience and ultimately help play our role in getting employers and employees back to work. And I think it's worth noting, just kind of as we begin and jumping into this, that there's a lot of factors that obviously go into an employer's return to work strategy. And these are, rather unprecedented times when literally it's one of the first times in my career where, nobody has the exact answer for how to do this effectively. And as an employer myself and my wife is also runs a business, a small business in New York. So we spend about 80% of our time talking about this, lucky for our kids. And the number one priority in my mind, kind of to your point, Rich, is how do we do this in a way that really makes our employees feel safe? For us, being in New York City, that presents a whole set of challenges. There's obvious work site modifications that maybe need to take place, and there's changes that'll take place in the physical office environment. But more than that, even how do I make sure that my employees feel safe coming into work every day? And for us, taking the subway or pushing the same elevator door button as others and being in close contact with people. And then really ultimately what we're trying to do here is create a world where, we feel like we're being thorough, we're giving employees the right resources and their family members the right tools and resources to ensure that they understand what's available to them medically and they can effectively navigate their own return to work in a way that makes them feel safe and makes them feel good about coming in every day. So a big piece to that strategy is providing access to digital tools. And unfortunately, this sort of state of things right now with relation to COVID is the news and guidance sort of changes daily, right? We're also living in a world where access to medical care can be somewhat limited, with many primary care offices taking shorter hours, elective surgeries aren't happening. It's sort of the essential of the essential are really open right now. And it sort of leaves folks in a spot where they need the ability to get the right medical care if they have concerns, and we need to make that easy. Rich did a good job kind of kicking off and introducing TouchCare. TouchCare, we're a healthcare concierge service. We ensure that our members have a better experience navigating healthcare by giving them access to expert health assistants who are there to help them navigate all of the complexities within the healthcare system. So increased member cost responsibility and lacking transparency in the system and a generally undereducated consumer kind of all lead to a world where most folks, aren't very good at actually navigating the healthcare system, and it costs everyone in the supply chain money. So we try to work directly with employees and their families to help solve that. And as an extension to what we do at our core, we also have tools to provide members access to virtual care at no cost to them. So no copay plans for real-time access, immediate access via chat, telephone, with licensed MDs who can help the member out with their medical situation via telemedicine. And by quickly navigating members to our virtual care team, we help them avoid unnecessary visits to the emergency room. We reduce unnecessary plan costs and expenses and hopefully improve that member experience as well as reduce costs for them. So moving on to the next slide here, how does all this kind of come in with COVID? And as I mentioned, our goal is really to help get people access during COVID or not, but really right now, our goal is to help get folks access to the right care or advice at the right time. And with our Touch Care Shield offering, which we just rolled out, what that means is, as an additional layer to the BenefitsApp COVID tracking, we're providing expert guidance to those employees, whether they're red, yellow, or green, but specific to those employees who are yellow or red, because green is just a little bit more straightforward. We want to make sure that we get them the right medical attention as soon as possible. So when we launched Touch Care Shield, it was designed to be, an extension of that core service, and it includes the telemedicine program at no cost for our employees. But when an employee registers as yellow or red, we want to get them on the phone with a doctor ASAP for symptom monitoring, symptom checking, and then ultimately for medical guidance on what to do next. One of the unique things about our Touch Care Shield offering is that through our telemedicine component, we're one of the few providers nationally with lab ordering capabilities for the COVID antibody test at any Quest or LabCorp location. So now we're sort of giving employees and their family members the right tools to properly navigate their healthcare situation. We're giving them access to doctors real time in a virtual format, so they don't need to go anywhere, and we can start to help ease those anxieties. And now we're able to actually get them tested at any Quest or LabCorp location for COVID antibodies. And because we're able to write the lab order for it, not only is it no copay, but the test should be covered by insurance through their insurance provider. And so we think that by sort of combining efforts with relation to the experience in the Benefit App portal, and then providing our plan members with actual guidance on what to do next, where to find care, how it all integrates with their plan, and then ultimately giving them access to real medical support and being able to get them tested, we're sort of creating a world and a service package where employees have access to the right tools virtually to sort of ease their anxieties around coming back to work, as well as giving our employers the right tools to be able to make sure that that workplace is safe, and that we make sure that that only the green folks are actually coming into work, and that we're addressing the red and yellow in a way that is making sure that once again they're healthy, they're safe, they've got medical guidance, and that it's not costing them anything. And so that's really the gist of the program, and how we're trying to make it easier for employers to ask their employees to come back to work by giving employees the right mix of digital tools that will enable them to do so in a safe and healthy way.
Thanks, Rob. Yeah, so in the theme of closing the loop, I just see this as so important. We have clients that have hundreds of employees, thousands of employees. One of our clients has 6,000 eligible members. Well, 6,000 employees and 14,000 eligible members. And just the pure, percentages, playing the percentages, let's say that 10% of those have a yellow or red status. How does any one team deal with that, other than hoping that they get, the help that they need, or they're taking action other than just monitoring their symptoms or sheltering in place or quarantining, self-quarantine? So the concept to me that if I'm yellow, an employer could say, okay, if someone's yellow, let them monitor their symptoms. But for those that are red, the concept that the next on that red screen, there's a click to call Touch Care to reach out to a health advocate that will ask you the questions. Do you have a primary care physician? Do you have the ability to go get tested? Let me get a doctor on the phone with you right now through MeMD, and we will prescribe COVID-19 antibody testing. That really closes the loop and informs the employer that action has been taken. It's just one less thing to worry about, as we have all these other things to worry about. So I think it's incredibly important. Thanks, Rob, for explaining that. And the reason why we're having this webinar is to just look at the full cycle of this program. With that, I'd like to just introduce Jonathan Anders. Jonathan is involved with BenefitsApp as a partner in the firm and has 25 years experience in the industry. He's really an industry ambassador, knows an awful lot about large group insurance programs, employer programs. So Jonathan, I was hoping that you could finish up our presentation today with some comments about what you're seeing in the industry. You're very active in the industry, and what you think is coming next. So Jonathan, could you just weigh in on this for us?
Sure. As I look at the very first slide, it has my name up there as an expert, and I will tell you, after listening to Rob speak and the introduction, I echo his thoughts. This is an unprecedented time, and the word expert concerns me because I've never really had to help any large employer navigate through times like this before. So maybe if we can take that off the first slide and just lead me to ambassador, and then collectively we'll all figure this out over the next couple of years. But I guess my thoughts are not only indicated here on the slide, but come with a perspective of what I'm either seeing, hearing, or are being asked about from employers and or broker relationships out there in the marketplace. And I think it echoes what Rob said. We have to come at this from a perspective, that healthcare is fragmented. It's a fragmented system. And so everybody is reacting right now. We see that with all the help that's being, asked for on a federal level, on a state level, et cetera, combined with decentralized regulation process. So coming at it from that, and then understanding that we're very early on in the year, and many people who are in high deductible health plans, have not yet met deductibles, and there's a lot of nervousness about, if I'm diagnosed, what's it going to cost? Do I have the money to pay over and above? Am I getting a paycheck, and will I have a job? I think when you look at the American Association of Insurance Plans just came out and basically said hospitalizations and the expense thereof for admissions are not going to be waived. But as Rob alluded to, on the front end testing, most of the time that happens without cost sharing. So to have a relationship with a company like TouchCare that can facilitate that, I think is outstanding. And, lastly, I think understanding that there's a shift in the employee benefit world overall in this pandemic from, what are you giving me or what are you providing me to how are you helping me? And that's probably the most resounding ask that I'm hearing out there is what else can we do for our employees? It's going to be tough enough trying to build culture in a remote world. It's going to be tough enough communicating to them. What more can I do for them and how can I help them? Your first bullet point on here is an employee willing to share personal health information with their manager. That's more a cultural issue. I think the current guidelines allow certain information to be understood if there is a positive test. But, I associate health information with the, vogue movement of wellness programs or population health strategies that, there's a fine line between being supportive and a witch hunt. And so there's a lot of trepidation about personal health information being shared and or where it resides. And the same holds true for, other family members. To connect employees with a trusted resource who can guide them to a healthier outcome, that's exactly what our relationship with TouchCare does. They have a value proposition. They're employee independent advocates. And in a fragmented healthcare system, they understand how to navigate it. So when an employer says, what else can I do to help my employees? It's that kind of relationship. It's looking at EAP products to see what type of resources out there from a financial stress, financial counseling, et cetera. So I think a lot of employers are not only wrestling with, return to work, but also, how can I help my employees? That I think is their number one goal. And lastly, the impact on benefits, cost to employers, cost to employees. as again, as Rob alluded to, right now we're kind of from a hospital perspective focusing on essential care. So a lot of elective procedures have been put on hold. There's a concern nationally that hospitals, are hemorrhaging. There may be some financial relief coming down the pipeline. So, there's pros and cons with that, because at the same time that there might be incurred expenses on the health plan outside of testing for inpatient hospitalizations and expensive treatment if ventilators are involved, there's also a delay in elective procedures that often come through a health benefit plan as well. And so we know by history that claims by themselves are what we consider lagging indicators. So we see Steve walking down the hallway, and we hear over the weekend he was taken to the emergency room in an ambulance because he had a heart attack, only to look back in his claims and realize that he hasn't gone to the doctor for the last 3 years and didn't focus on prevention. And so what I see large groups doing right now, at least on the forefront, is trying to associate themselves with some kind of data analytics partner and really looking at past claims to see if there are areas for potential intervention or evaluation along the lines of comorbidities, or what the industry calls disease-related groups. So as we know from some statistics that have come out right now, the vulnerable populations are not only older, but those that have comorbidities. So I think the proactive employers are really doing two things, to summarize. Number one, figuring out what else they can do, and answer the question, how are you helping me? And not just looking at their benefits plan and saying, what are you giving me? And then lastly, trying to take that proactive step and looking at their population and doing some calculations in a what if scenario so that they could better position financially, depending on their geography and their industry codes, understanding comorbidities within their existing population. So that's what I would say right now, boots on the ground that I'm seeing, hearing, and being asked about on a weekly basis.
Thanks, Jonathan. I appreciate your commentary. And I think we're looking at our next webinar. Jonathan and I were discussing this earlier, and he has seen some research around this that we may have a follow-up webinar on, specifically around benefits and costs and things like that. So that more to come there, and so I appreciate it. I'd like to remind, if anybody has a question, they could submit it by chat to myself, Rob, or Jonathan. We are also available for follow-up conversations, demonstrations, things like that. So a quick check-in on our feature roadmap. We will be deploying our COVID-19 application this week, but available to employers and our clients and prospects on Monday of next week. We can release this feature function set as a standalone feature within the Benefits app within 2 days of agreement. We can also add in benefits information. A typical Benefits app takes about a week to 2 weeks to configure, such that you can look at it from an HR team perspective, and then we help you to deploy it to your employees through an employee adoption marketing program that includes both printed material, digital postcards, as well as an email program to employees on how to download Benefits app and then use it to have a healthier, less stressful existence. So I want to thank everyone for attending our webinar. And again, if there are any questions, I don't know if we have any questions coming in just yet. Again, thank you for attending, and we're going to go ahead and finish up. I will follow up with everybody personally, and we'll send you a link to a recording of the webinar for your reference, and we'll invite you to future webinars as well. Thank you, and have a nice day.